Rheumatoid arthritis is a chronic inflammatory condition. It can affect anybody, but the women are more prone to it because of their hormonal imbalances that can exist prior to them presenting with RA. The RA, the process, the pathogenesis or the disease process is that very inflammatory immune cells infiltrate the actual wrists or the knee, in other words, the articulations, and they sit there and they secrete these very potent inflammatory cytokines or messengers, such as interleukin-6 or IL-1 beta and IL-17. And we did a study, placebo-controlled, where half the patients did not get the Moducare, the others did, to show how people with RA using the Moducare, the inflammatory markers decrease. So it's a very good marker that we can measure in the blood. The inflammatory markers such as C-reactive proteins or the ESR, erythrocyte sedimentation rate, but also the IL-6 and the IL-1 beta decreased in the serum or in the blood of these affected individuals. They would report they had more mobility when they woke up in the morning, they were less stiff. Rheumatoid arthritis is a typical autoimmune condition because we can see the joints that are affected. Most people who are affected by RA will relate morning stiffness. They have battled to get out of bed because the joint is sore, painful, as well as stiff. Now that is because the inflammatory condition that's taking place in the joints leads to the actual destruction of the cartilage between the two bones. That is why it's painful. So Moducare, we showed in fact in a clinical study that individuals using the Moducare had less inflammation, firstly, according to the blood levels that we measured. Secondly, they reported, it was a self-reporting chart or questions, that they had more mobility. And these are people who were battling to get out of bed in the morning, and suddenly by using the Moducare, they had more mobility.